lot of our patients find themselves spending a lot of time in queues. And I was definitely one of those people. I was diagnosed with TB in 2014, and I was collecting chronic medication at my local clinic. I found that I was losing about 4 hours every time I needed to go collect treatment. I was one of those patients that kept on complaining to my nurse, ultimately saying, why am I losing so much of my time? I was on treatment for about 8 months, and I was deeply curious about why is it that we have to lose so much time. And I think it's in a context where we've done well as a country to make a lot of medicine available through the efforts of the National Department of Health and its partners, such as HST, such as Global Fund and PEPFAR and all of the other entities. Ultimately, there was a very strong conviction for me to say, what can I do as a patient to be able to participate in this ecosystem and to be able to build a solution? The products that we ended up creating are these digital lockers where we are then able to take pre-packed medication loaded inside. It would then send an SMS to a patient saying, hey Neo, your medication is ready for collection, here's a one-time pin. Neo would simply be able to walk to the locker and collect their chronic medication. We've been able to show that we can get a patient collecting chronic medication from a locker in under 30 seconds. This is from the time somebody walks to the locker, enters their cell phone number, enters their PIN, collects their medication, and then ultimately walks out. So from when you start typing 082, we start a time at the time, to when you close the door. And I know on my slide it says 30 seconds, but technically on average across all of the sites, it is about 22 seconds on average. And that was a strong validation of the initial hypothesis that we had around how ease of use can effectively lead to convenience, and ultimately wanting to drive that connection between convenience and adherence and good clinical outcomes, which is also one of the pillars of the Double Up Myth program and the intended benefit that we want to be able to achieve. So far, we've been able to show that a locker can serve anything from 400 patients per month to 1,000 patients per month, being able to ensure that collections can happen. The way that it works is that we integrate these lockers as collection points on the Double Up Meds program or on any other system. Pre-packed medication would then be loaded into the locker. At that point, an SMS is sent to the client, and hopefully in future, we want to be able to look at WhatsApp and other modes of connections like QR codes for those that might have smartphones to be able to leverage the technology to validate themselves that the lockers work. The second point is that the patient would come on the collection date that is allocated to them. They would enter that cell phone number, enter that PIN. It would then pop open the door that has their medicine inside. They would collect and they would be on their way. Last year, we've had over 1,652 parcels collected through these lockers. So we celebrated the 1.2 million mark, and then celebrated the 1.5 million mark. So there is also context of being able to show how, in partnership with the Double Up Miss program and the lockers, we've been able to show good usability, good traction, good retention of all of these lockers. On average, on a monthly basis, some of our parcels are within the 50,000 parcels collected from this network of lockers across as well. Ultimately, this work has gone on to the world. Last year, we were receiving an award from the Royal Highness Princess Anne for one of the most innovative solutions in the continent, where I had the chance to travel to London, receive an award for one of the most innovative solutions that has come out of this part of our world. We've received prizes, we were featured in Time Magazine's Best Inventions of 2019. And that was such a monumentous moment for me, where I'm like, a boy from Northern Cape, on Time magazine. It was such a moment to be able to create something like this that ultimately has gone on to gain global recognition as well. Our next goal, which is why I'm making an invitation to everybody in this room to help us reach this. We want to get to 500 communities where we've set up these collection points. We are looking for partners and funders that are able to help us make this a reality. We want to get to a point where out of this network of lockers and potentially other innovations, we're able to serve 500,000, 1 million people that are collecting chronic medication, leveraging some form of technology to be able to gain their time back.